Hi there. For those of you who don't know me, I'm Jen. I'm the practice manager at Evendale-Blue Pet Hospital. As I've mentioned in a previous video, AAHA evaluates us on many different topics. And today I want to talk about two that I feel are two of the most important ones that they regulate and that they evaluate us on. And those two are anesthesia and surgery. I know for pet owners, especially being one myself, anesthesia and surgery, they're just, they're a little scary. When you leave your pet with us for the day for a surgical procedure where anesthesia is going to be needed, we want to make sure that you feel confident that your pet is going to be safe and cared for in the best hands possible. So let's talk about some ways that AHA helps ensure that that's going to happen. So, first and foremost, AHA regulates that there has to be a licensed veterinarian overseeing everything related to anesthesia and surgery. And I can tell you with 100% certainty that our veterinarians are so invested in the safety of your pet when they come in for a surgical procedure. They are there 100% of the way, every step of the way. Another topic that AHA regulates is that there is a dedicated, well trained team member dedicated just to monitoring the anesthesia portion of your pet's procedure. So, what that means is if there are other tasks that need to be done during the procedure, such as assisting with surgery, cleaning teeth, taking x-rays, anything that's not just monitoring anesthesia, someone else is doing that. So we have someone that 100% of your pet's procedure, they are watching that monitor and watching your pet so that we can make sure that every step of the way, your pet is safe during anesthesia. Another area that AHA evaluates us on is making sure that we have the correct, up to date equipment for monitoring your pet during anesthesia. So for us, that includes capnography, which measures the level of carbon dioxide that your pet is inspiring and expiring. We have parameters that we know are safe, and we make sure that your pet stays within them. We monitor their pulse, their ECG, blood pressure, temperature, respiration. Every aspect of your pet's vital functions are being monitored constantly during their procedure. We also place an IV catheter in every single patient undergoing general anesthesia, and also every single patient undergoing anesthesia has an endotracheal tube in place. So that's the breathing tube that goes into their trachea during anesthesia. So these two areas, the IV catheter and the endotracheal tube, give us vital access to your pet to make sure that they stay safe during anesthesia. We can regulate their depth of anesthesia. We can regulate their blood pressure through the IV catheter using fluids. And it also gives us immediate access to vital areas of your patient if anything starts to fall outside of those parameters that we monitor so closely for. So AHA has many, many other topics related to anesthesia, including parameters for temperature regulation, how we document pre-op, post-op, and the procedure itself, the training that's required, and the patient assessments that are required. And we follow all of them to keep your pet safe. Outside of anesthesia, surgery is its own separate category that we are evaluated on. That includes things like we have a dedicated surgical suite that is properly cleaned and sanitized for your patient safety. There are also regulations on our equipment that it be up to date, maintained well. Our equipment is sterilized properly in between every patient. So as you can see, AHA really has a broad spectrum of areas that are very important that get regulated. And we stay up to date on all of these areas. Again, patient safety is our number one top priority when it comes to anesthesia and surgery. And we do everything that we possibly can do to look out for the best interest of your pet. And of course, if you ever have any questions or concerns related to anesthesia or surgery or anything else, always give us a call 513-563-0410 or email us at info@ebapethospital.com.